Here's 2 common reasons why your period might be irregular that get mixed up all the time. So, first, you've probably heard of PCOS. Second one, you probably may not have heard of is hypothalamic amenorrhea. The reason why these two get mixed up is because they both have irregular cycles. Sometimes you get a period or you go long phases without one. That's why they get mixed up. PCOS is really governed by high androgens. And typically we can see some insulin resistance as well. Now, with hypothalamic amenorrhea, again, we see those irregular cycles, but we see low hormone activity, and usually this has to do with undernourishment, so too high energy demands. So hypothalamic amenorrhea can be very common in eating disorders, very common in athletes. You can see this with like stomach and like intestinal issues, if you're not absorbing your food properly. And if you were getting an ultrasound, you could actually see those PCOS cysts, which are just underdeveloped follicles, in both of them. Now, when you are testing for blood work, typically with PCOS, you're going to see a lower FSH or a normal FSH and a higher LH. So LH typically is higher than FSH. And then with hypothalamic amenorrhea, you typically have both of them being low. So both LH and FSH are lower. One way you can check this at home is that if you're going long periods of time without any periods, if you are getting patches of cervical mucus, that can be more of a sign of PCOS because we're still having that hormone activity. Because remember that estrogen is going to cause the cervical mucus. So if you're getting that hormone activity from FSH, that's going to grow the follicle, meaning we have higher estrogen, meaning we're going to see patches of cervical mucus. If you're not getting any of that and you're not having a period, that could point to hypothalamic amenorrhea because we're not getting the FSH developing our follicle, so then we're not getting those increases in estrogen and we're not getting cervical mucus. Figuring out which one you actually have, if any, is very important because the way we treat these are very different. Let me know if that helped, if you guys have any questions about PCOS or hypothalamic amenorrhea.